What if one diagnostic test could change how you treat your patients and at the same time cut healthcare costs? In this week's episode of Your Practice, Your Money, I'll show you the hard evidence behind EMG and MSK ultrasound, how they guide more accurate diagnosis, how they improve outcomes, and how they help your practice stand out in a value-based care negotiation. If you want to elevate your clinical precision and strengthen your financial position, this episode is for you. See you in a moment. Welcome to Your Practice, Your Money, the podcast where clinical success meets financial freedom. I'm your host, Dr. Dimitrios Kostopoulos. Today, we are talking about something that's truly transforming physical therapy as well as medical practices across the country. The evidence showing how electrodiagnostic testing, in other words, EMG and nerve conduction studies, as well as musculoskeletal ultrasound or MSK-US, not only improve patient outcomes, but also reduce overall healthcare costs. And that, my friends, is the kind of data that gives you leverage to negotiate better reimbursement rates with insurance carriers and with independent physician associations, IPAs, because you are now offering services that improve quality and at the same time reduce costs. And that is the holy grail of value-based care. And everybody is talking about value-based care. Everybody is looking, insurance companies, IPAs, they are looking, what you do, does it offer value to the patients? And what you do, does it reduce costs, which means value to the health insurance industry? So why diagnostics matter? Well, when we talk about diagnostic testing, especially in physical therapy, but also medical practices, we're talking about objective, evidence-based tools that make our clinical decision-making, they take it to the next level. Well, think about it. Every day in practice, we see patients with numbness, tingling, burning sensation, weakness, shoulder pain, knee pain, back, neck pain, and we rely simply on our clinical examination to decide what is going on with that patient. But when we combine our hands-on skills with electromyography and musculoskeletal sonography imaging, we move from educated guesswork to objective precision. And this changes everything, not just for the patient, but for the entire healthcare system. All right, so what is the evidence then? How EMG changes patient management. So let's look at the evidence, and I am going to talk here about some studies that provide evidence. And those of you who will go to our website, yourpracticeyourmoney.com, or watch this on YouTube instead of just listening it, you'll be able to see some slides that provide the information that I will give you right now. Well, in 2018, a study was performed by Lindstrom and Ashworth. That study was published by Muscle and Nerve, which is one of the most prestigious publications in the electrodiagnostic profession. And that study found that electrodiagnostic testing resulted in 51.5% change in diagnosis and in 46.5% confirmation of an existing diagnosis. And 63.4% had a change in patient management. This is very important. The authors concluded that EMG testing significantly guides diagnosis and treatment in neuromuscular disorders. In other words, EMG just doesn't only confirm what we already know, but it changes what we do. I'm going to say that again. EMG testing, the evidence shows that it does not just confirm what we already know, but it changes what we do. It leads to better, more accurate treatment. Now, let's see, because this study was done in general practice and pain management, neurology, and primary care clinics. Now, let's see a study that we undertook as an organization and published in 2020 that was done over in multiple centers across the country with the participation of 462 patients. Very robust study. So in this study, performed by Dr. Rawat, myself, and Dr. Kostopoulos, and many others of our colleagues, it was published in the Journal of Bodywork and Movement Therapies. In that study, we found that 60.61% of patients had their management plan changed after the performance of EMG nerve conduction testing. And 92% of the patients reported high or very high value from the performance of the diagnostic test. Well, patients felt they understood their condition better, and they were more confident in their treatment and were more likely to follow through with the physical therapy care. Well, that's clinical transformation in action. What is the broader evidence and cost efficiency? Well, this is not new. As far back as 1998, Kothari and colleagues showed that EMG testing altered diagnosis or management in more than half of all cases referred for neuromuscular evaluation. But here is the kicker. By providing objective, functional information, EMG testing reduced unnecessary MRI or CT scans and prevents inappropriate specialist referrals. That's how we save the healthcare system money, and that's exactly what payers want to see. And this is exactly what a primary care physical therapist is supposed to be doing. Well, let's look now about the role of MSK ultrasound. We'll talk about MSK ultrasound, a technology that gives us real-time visualization of soft tissues, tendons, and joints during motion and function. In 2017, a study published by Tagliafico and Bianchi in seminars in musculoskeletal radiology demonstrated that MSK ultrasound provided immediate diagnostic feedback, which improves the speed and accuracy of care while supporting cost-effective decision-making. Well, think about it. When we can detect a tendon tear, a joint effusion, or a nerve entrapment in real time, we reduce the need for unnecessary MRIs or surgical consultations. We guide our treatment precisely from day one. Early detection, faster recovery, lower cost. That's the definition of value. Early detection, faster recovery, lower cost equals value. What is the value proposition here for IPAs and for insurance carriers? What does this mean for your practice and for your relationships with insurance carriers or relationships with IPAs. Well, by integrating EMG and MSK ultrasound testing in your practice, you're improving clinical precision by providing physiologic and anatomic confirmation of pathology. You enhance value-based outcomes, early targeted interventions, in other words, that prevent chronicity and unnecessary utilization. And you are reducing total cost of care by decreasing redundant imaging, external referrals, and delayed recovery. These are the metrics that insurance companies and IPAs care about most. They're looking for practices that deliver better results at lower costs. And we have the data to prove what we just did. This is the foundation for negotiating better reimbursement rates. It's how we shift from being seen as a cost center to being recognized as a value center in healthcare delivery. So, as we've seen today, the evidence is crystal clear. Electrodiagnostic and musculoskeletal ultrasound testing do more than confirm what we suspect. They transform how we diagnose, how we treat, and how we demonstrate value to the healthcare system. They help patients recover faster, improve outcomes, and reduce costs. And that gives every practice a powerful advantage when negotiating with payers and IPAs. Diagnostics are not just tools, they are leverage, clinical leverage, strategic leverage, financial leverage. If you haven't yet explored implementing EMG or MSK ultrasound in your practice, now is the time to take that step and elevate the level of care you deliver. Thank you for joining me today on Your Practice, Your Money. If you found this episode valuable, be sure to subscribe on Spotify, Apple Podcasts, or wherever you listen, so you never miss an episode that helps you build both clinical success and financial freedom. And if you know another colleague who could benefit from this discussion, share this episode with them. Help spread the message of what diagnostics-driven physical therapy can achieve. Well, see you next week. Until then, keep building clinical success and financial freedom. Take care.